Fellow Nigerians and friends from around the world, good day to you all. I'm thrilled today to share insight with you on an issue that affects millions of our nation's households and businesses, and that is the issue of health insurance accessibility. This is amidst our drive to achieve universal health coverage for all Nigerians. Today, out-of-pocket payments for health continues to be a dominant source of healthcare expenditure for the majority of our people. This means high costs for families and even lower standards of accountability for the health providers. When the Federal Ministry of Health and Social Welfare signed into the Renewed Hope Ministerial Performance Compact with Mr. President, inclusive of its detailed performance indicators, we set an ambitious 2030 target that we are now on course to meet, one of which is the national health insurance coverage. Under the leadership of His Excellency President Bola, Ahmed, Tinubu, GCFR, all the macroeconomic reforms and policy directions of government are aimed at co-creating the conditions for each and every Nigerian citizen to ultimately actualize their personal and professional aspirations while catering to each of their unique needs across all walks of our national life as we move closer and closer to being a more peaceful, prosperous society. In line with Mr. President's drive, this people-centered approach and its execution has defined the work that we do in the Nigerian health sector. Even as we work hard to modernize outdated health infrastructure in primary and tertiary health institutions across all areas in our federation, our success in national health insurance enrollment is crucial as well in aligning the demand side with Nigeria's fast and newly emerging supply side interventions, both human resources and infrastructure in our health sector. On the supply side of the healthcare access challenge, we've already successfully retrained nearly 70,000 health workers from 2023 to date, even as we have concluded the recruitment of almost 20,000 doctors, nurses, midwives, community health extension workers to address the health worker attrition that is prevalent all across our country. After breaking the health insurance enrollment record that we made in 2024, with over 2.4 million Nigerians enrolled, and in view of the population currently under coverage, standing at 20 million Nigerians, with the new policy tools that we're deploying, we are now on course to achieve our target of enrolling 44 million Nigerians with health insurance coverage by 2030. This is the surest pathway to curbing high out-of-pocket healthcare spending in our country, which sadly presents about 70% of total healthcare spending in Nigeria. It is crucial to appreciate that presently, social health insurance schemes comprise almost 90% of all insurance enrollments nationally. One of the main obstacles that had undermined the efficiency and care quality of Nigeria's insured population has been the low capitation fees for insured patients for a very long time. Capitation payments represent an agreed fixed monthly fee given to healthcare providers for each patient in a capitated health plan, regardless of the service frequency. These payments are predetermined annually and are designed to control healthcare costs while providing consistent revenue for medical providers. In Nigeria, for several years now, the capitation fee was paltry 750 naira per enrollee. We have now broken the jinx by doubling the capitation fee to 1,450 naira per enrollee to ensure that healthcare providers are better placed to provide the highest quality of care to insured patients on a consistent basis. Fee-for-service rates have also been revised upwards by 380% based on actuarial evidence that best aligns cost-reflective rates with the quality care requirements. Furthermore, the federal government has introduced the one-hour referral authorization form, which is submitted to a care provider by the insuring entity and indicates that a referral for a patient has been approved. By shortening this process to 1 hour, we will reduce burdensome delays for enrollees seeking a referral from a primary healthcare physician to a secondary or tertiary care specialist. I am pleased to report to all Nigerians that we have instructed the National Health Insurance Authority to commence covert mystery shopping to monitor healthcare providers and ensure that enrollees are not denied quality treatment when they need it. With undercover monitors observing the process from inside of the facilities, this administration is ensuring that Nigerians and all insured patients do not suffer at the point of accessing services that are covered. The evidence clearly indicates that our reforms are making an impact on patients' confidence in the healthcare system. From fewer than 10 million quarterly visits to healthcare facilities recorded in 2023 to now over 46 million visits recorded in just the second quarter of 2025 alone. We're seeing the reforms in the Basic Healthcare Provision Fund and National Health Insurance Authority achieving significant impact. The quality of the health insurance packages ultimately relies on its wide adoption, and as the pool of Nigerian health insured increases, more benefits will accrue to the insured and more risk protection to the population that are insured. We are on our way to achieving His Excellency President Bola Ahmed Tinubu's vision of a health sector that caters not only to the wealthy but all Nigerians, irrespective of their social status and income range. And we will not stop our relentless drive until every Nigerian is ultimately covered and catered for over time. Thank you, and may God bless the Federal Republic of Nigeria.